If you have deep buttock pain that shoots down your leg and nothing you have tried has actually resolved it, keep watching because you may be treating the wrong condition entirely. Most people performing sciatic exercises from a video they watched on YouTube are likely working on a diagnosis they never properly confirmed. When you treat the wrong condition, the leg pain does not improve. It returns every time, often more intense than the session before. In this video, you are going to learn the exact anatomical difference between piriformis syndrome and true disc-related sciatica. You will also get 2 screening tests that you can do at home to identify which condition may apply to you. In addition to that, you will also get 2 targeted exercises for piriformis syndrome and 2 exercises for sciatica that is caused by a disc herniation. Be sure to watch the whole video because missing even one part of this process could be the reason your sciatica pain keeps returning and the leg pain eventually becoming chronic. Hi, I'm Dr. Tam, chiropractor here in San Jose, California, and I have seen many patients spend months performing the wrong exercises because they never received a proper explanation on what was actually causing their symptoms. Now, I created this channel for people dealing with back pain, disc injuries, or sciatica who have tried everything and are tired of temporary fixes and want to understand what is actually driving their pain. Now, here you're going to learn safe, non-surgical, science-based ways that you can reduce your pain, restore your movement, and get back to doing the things your condition has been holding you back from. Subscribe if you want clear answers, real results, and the confidence to move without constantly worrying about your pain. Here is the simplest way to think about piriformis syndrome versus sciatica. Now, in both conditions, the sciatic nerve becomes irritated and creates radiating leg pain, numbness, tingling, or burning down the leg. But the origin of that irritation is completely different. With disc herniation and sciatica, the nerve gets compressed at the spine, usually from a bulging or herniated disc in the lower back region. With piriformis syndrome, the sciatic nerve gets compressed farther down in the buttocks by the piriformis muscle itself. The difference matters more than people realize because the wrong sciatic treatment often keeps the nerve irritated longer. One of the biggest frustrations I hear from patients is that they keep doing sciatic stretches and sciatic nerve exercises that they found online, but the leg pain keeps coming back because they never identified where the compression was actually happening. And this is where things get tricky. Both conditions can feel almost identical at first. So how do you separate one from the other? The first clue usually shows up in how your symptoms behave during sciatic movements and positions. Now let's move to 3 screening tests to determine where your sciatica could be coming from. Before we move into the physical tests, I want to make one thing very clear. These are not diagnostic tests, and this video is not replacing a proper medical evaluation. Think of this as a simple 3-step at-home screening process that may help point you in the right direction before you begin sciatica exercises or piriformis exercises on your own. If your symptoms are severe, worsening, or not improving at all, you should absolutely be evaluated by your doctor or healthcare provider. Step 1 is what I call the location test. Most people focus on where the leg pain travels. Clinically, the starting point is often much more revealing. With disc herniation sciatica, the symptoms usually begin in the lower back region first. Then the pain radiates into the buttocks, down the thigh, and sometimes into the calf or foot. One of the biggest frustrations I hear from patients is that they focus entirely on the leg pain while ignoring the lower back symptoms that were there first from the beginning. Piriformis syndrome often behaves completely differently. Now, the pain commonly starts deep in the buttocks itself, especially after sitting, driving, or prolonged pressure through the piriformis muscle. Then the symptoms begin traveling down the leg from there. Many people with piriformis have very little actual back pain at all. The location test is simple. Ask yourself this. Before the pain started to shoot down your leg, where did it truly begin? Did it start in the lower back first? Or did it feel like the problem was buried deep in the buttocks from the start? That answer alone is not enough to confirm what's actually causing the sciatica, but it gives us an important clue before we move on to the next step, which is step 2, the FAIR test, where we start to test and stress the sciatic nerve itself. Step 2 is the FAIR test, F-A-I-R. Now, FAIR stands for flexion, adduction, and internal rotation. This test places the piriformis muscle under tension to see whether it reproduces that familiar sciatica pain or deep buttocks symptom. Start by lying on your unaffected side with the painful side facing upwards. Bend the top hip and the knee to roughly a right angle, and from there slowly move the top knee slightly downward towards the floor while rotating the lower leg upwards. That position stretches the piriformis muscle directly over the sciatic nerve. Now pay close attention to what you feel. If this recreates that deep piriformis pain, burning in the buttocks, or a shooting sensation traveling down to the back of your leg, that is considered a positive FAIR test. A pattern that shows up again and again is patients immediately recognizing this is an exact pain they feel while sitting or driving for long periods. If you only feel a mild muscular stretch, that is less suggestive of a piriformis syndrome. If you feel sharp pain in the front of the hip instead, that may point more towards a hip issue rather than the sciatic nerve compression from the piriformis muscle. Now, let's move into the final screening test, which stresses the sciatic nerve in addition to the L4, L5, and S1 spinal nerve roots. This screening test is called the Slump test. While the FAIR test stresses the sciatic nerve around the piriformis muscle, the Slump test places tension on the sciatic nerve closer to its spinal origin. Now, this helps screen for disc herniations, sciatica, and nerve root irritation coming from the lower back. Sit near the edge of a chair with your feet flat on the floor. Slowly slump your shoulders forward and lower your back forward while drooping your chin towards your chest. From that position, straighten the affected leg out in front of you and gently pull your toes upwards towards your shin. You're not trying to force a stretch here, okay? You are checking to see whether this position reproduces that familiar sciatica pain, tingling, burning, or pulling sensation down the leg. If this test recreates your shooting leg pain, especially when combined with lower back pain, that points more towards a disc-related sciatic nerve irritation. If the FAIR test was positive, but the Slump test was not, piriformis syndrome becomes more likely. If both tests reproduce symptoms, there may be overlap between the spine and piriformis muscle involvement. Now that you have gone through the screening tests and have a better idea where your sciatica pain may actually be coming from, let's move into 4 targeted stretches and exercises that may start giving you some relief. We will start with the piriformis specific stretches, then move into exercises more commonly used for sciatica caused by a disc bulge or disc herniation. The first piriformis stretch is the supine figure 4 stretch. Now, this is one of the most effective piriformis exercises for reducing tension around the piriformis muscle and creating more space for the sciatic nerve in the buttock region. When the piriformis becomes tight or irritated, it can compress the sciatic nerve and create radiating or sciatica pain down the leg. Now, this stretch helps lengthen the muscle and reduce some of that pressure. You will be performing this exercise lying down on the floor. And the goal is gentle, deep stretching through the buttocks, not aggressive pulling or forcing range of motion. With every exercise, only do them to your comfort and tolerance. A little bit of leg discomfort or mild pulling can be normal during the sciatic nerve exercises like this, especially if the nerve is already sensitive. But if this movement significantly increases your shooting leg pain, numbness, or burning symptoms, you need to ease off the stretch and stop completely. You want to start on the floor, nice comfortable surface on your back. And first thing you're going to do is you're going to cross the affected leg. So in this case, we're going to cross the left leg over the other knee. Okay. And then in this position, oftentimes, if it's super tight in that piriformis, you're already going to feel a little bit of tightness in that area. To go ahead and stretch the piriformis, we're going to go ahead and bring this knee up. You're going to reach through the hole. You're going to grab your leg. And you're going to pull up. And you're going to hold that for about 10 to 15 seconds. In this position, you're going to feel a deep stretch in the groin, sometimes the hamstring, and into the piriformis muscle. So on the other side, I'll show you as well. Cross it over here, reach through, grab the leg, and then pull up towards you. And again, you're going to feel that stretch right in through that piriformis muscle. I also wanted to give you another variation of the piriformis stretch for people who may have difficulty getting down onto the floor. And you may be dealing with some knee stiffness or looking for something that can easily be performed throughout the day at work or at home. This seated piriformis stretch targets the same general area of the figure 4 stretch, but in a more upright and accessible position. It helps reduce tension through the piriformis muscle and improves mobility around the hip, which may actually relieve pressure on the sciatic nerve when the piriformis muscle is the contributing factor of your sciatic pain. You should feel a deep, gradual stretch deep in the buttock area on the affected side, not sharp pain or aggressive pulling down the leg. Again, only do what is comfortable for your body. You should never feel like you're forcing the stretch or trying to make it more effective. If you find it difficult to lay on the floor or get onto the floor and you're afraid that it's going to be hard to get back up, an alternative is to just sit on a chair or on a table, something like this. And what you're going to do is this. You're going to go ahead and sit on the edge of a chair or table. Go ahead and cross the affected knee over the other one. So this is the side that you're having the leg pain. And in this position, I like to put one hand on my ankle, the other one on my knee, sit up nice and straight. And what you want to do is you want to bend forward. And when you're bending forward, we're not bending on the mid-back, we're bending at the waist, all right? So take a deep breath in, blow all the air out. Now as you exhale, the diaphragm raises, and I want you to go ahead and bend forward like that at the waist, and you should feel a nice deep stretch into the piriformis. So this is similar to laying down on your back, and instead of bringing your knees to your chest, you're bringing your chest down to your knees. Okay? Hope that helps. If your screening tests point towards disc-related sciatica from a lumbar disc herniation or bulge, here are 2 exercises that are known to relieve the sciatic leg pain caused by a lumbar disc compression. The first exercise is the prone lumbar extension. This is an exercise that is one of the most commonly used exercises to help reduce pressure on the irritated nerve root caused by a disc herniation or bulge. Now, the prone press up is designed to encourage movement away from the compressed disc area in the lower back region. For some people, this can actually help decrease the sciatic nerve irritation and reduce the radiating leg pain traveling down the thigh or calf. You will perform this exercise lying face down on the floor while gradually extending the lower back in a controlled way. Now, the goal is not to force the spine into an extreme position. You are looking for a symptom improvement, especially if the pain begins moving out of the leg and towards the lower back. That centralization effect is often very encouraging and a sign that the disc herniation, the sciatica, is recovering. A little stiffness or mild discomfort in the lower back, can be normal during this movement. But if your sciatica, the pain becomes sharper, travels farther down the leg, or increases significantly during these exercises, ease off and stop completely. Go slowly, stay consistent, and do not force the movement if your symptoms start increasing. The way that you do prone lumbar extensions, we're going to go ahead and lie on the floor, nice stable surface. Go ahead and get onto your elbows like this. You're going to go ahead and drop your chest down, and then you want to go ahead and do a press up. And as you press up, you're contracting your glutes at the same time and extending backwards, okay? So really important to note is that you don't want to go into pain. So as you push up, if this is all you can go, perfectly fine. Hold that position for about 10 to 15 seconds and then bring it back down, okay? If you can go more, fantastic. Go a little bit more. Hold that there. And if you can progress up to 30 seconds, that's even better, and just go and hold that position there. Okay? Now, if this is easy and you want to get more movement in the extension, what you want to do is go ahead and get onto your hands as such. Again, start at the bottom and then go ahead and press up like this. Now, as you press up, you want to squeeze your glutes together, squeeze the butt cheeks together, hold that there, look straight up, hold that there for 15 to 30 seconds if you can, and then come on back down. And again, remember, don't go into pain. So if this is all you can do, that's fine. Work your way up as you go along. Okay, that's how you would do prone extensions. The second exercise is called a sciatic nerve glide, sometimes referred to as nerve flossing. Now, this exercise is designed to help the sciatic nerve move more freely through the surrounding tissues after it has become irritated from the disc herniation and sciatica over a long or prolonged period of time. When the sciatic nerve stays irritated for long periods, even normal movement can begin feeling tight, sensitive, or painful. Now, this exercise uses gentle motion to improve mobility of the nerve without placing excessive stress on it. You will perform this exercise lying on your back while slowly moving your leg and ankle through a controlled range of motion. The goal is smooth movement, not an aggressive hamstring stretch. You may feel some mild pulling or tension down the back of the leg during the exercise, and a small amount of discomfort can be normal when the nerve is sensitive. But if the movement causes sharp sciatica pain, increased tingling, burning, or symptoms that continue worsening afterwards, ease off the range or the motion or stop completely. With sciatic nerve exercises like this, slower and gentler is usually more effective than trying to push through the symptoms. To perform the supine nerve glide, you want to go ahead and lay on your back on the floor, and you want to take the affected leg, which is the leg that has the leg pain. Okay, you want to go ahead and bend the knee on that side, and the unaffected leg, go ahead and rest it down flat on the floor. In this position, you want to do 3 sets of this movement here. And so you're going to bring the knee up, you're going to hold on the back here, and you're just going to go ahead and pump the leg slowly up and down like this. Okay, you want to do about 6 to 10 repetitions. And once you're done those 6 to 10 repetitions, you can stop and do 3 sets. Okay, now the key is when you bring the leg up, you want to go only to the point where you don't get that shooting pain down your leg. All right, so you want to go just to the point where you feel the shooting pain, and then back it off a little bit, and then just pump the leg like this. Now the next phase that you could do is you can do the same thing. Go ahead and bring the knee up until you feel that shooting pain, back it off a little bit, and then go ahead and pump your ankle up and down. Again, 6 to 10 times, and you could do 3 sets. Okay? Super easy. You're going to go ahead and feel that nerve gliding through this area, relieving that tension. Also, if you want, and it's too much pressure on your knee, you can go ahead and bend both knees instead of having that leg flat, and then do that same movement, just like that. So that'll just decrease some of the tension that you feel. All right, that's how you do the supine nerve glide. You now know the difference between piriformis syndrome and sciatica from a disc herniation. More importantly, you now have a simple 3-step screening process to help point you in the right direction. Leave a comment below and tell me which one of your symptoms matched more closely based on the screening tests that we just went over. Was it more consistent with a piriformis syndrome, or did it feel more like a true disc-related sciatica? And remember, these are still screening tools, not a formal diagnosis. Always make sure to get properly evaluated by your doctor, chiropractor, or physical therapist, especially if your sciatica pain is severe, worsening, or becoming chronic. You also now have targeted sciatica relief exercises you can actually start using based on the symptoms and the patterns of your leg pain. Let me know which one of these exercises gave you the most relief after trying them. If you found value in this video, like and share it with someone else dealing with leg pain, back pain, or ongoing sciatica nerve irritation so that they can stop guessing and start targeting the right problem. If you want to protect your spine, better understand your condition, and learn treatments that actually help people get long-term relief, make sure to subscribe to my channel because I release a new video every week. And if your sciatica is coming from a disc herniation or a disc bulge, and you want to see how we use spinal decompression to target the disc itself, to reduce the pressure on the sciatic nerve, and to help patients work towards long-term relief, go watch that video next.